I'll be explaining the Ottawa ankle rules. So first, there will be midfoot area pain and either tenderness at the base of the fifth metatarsal, tenderness over the navicular bone, or the inability to bear weight for 4 steps. The other Ottawa ankle rules is malleolar zone pain and tenderness over the posterior edge of the distal 6 centimeters of the lateral malleolus, or medial malleolar tenderness, and inability to bear weight for 4 steps. I will be demonstrating the test item cluster for patients that would respond to spinal stabilization exercises. So first, age less than 40 years old, an average straight leg raise of greater than 91 degrees, aberrant movement with standing flexion and return to flexion, and a positive prone instability test. Go ahead and lift your legs off the table. I will be demonstrating the test item cluster for patients that would respond to spinal manipulation. So first we have acute, which would be less than 16 days, non-radiating pain, the FABQ work portion, less than 19, hip internal rotation greater than 35 degrees, and then hypomobility with PA glides. So flip over. I will be performing the McMurray's test for a meniscal pathology. So providing a varus and valgus force with the foot at internal and external rotation. And looking to reproduce their pain. I'll be performing the anterior drawer test for ACL deficiency. Feel the joint line to make sure the tibia is in a reduced position already. I'll be performing the straight leg raise test for lower limb neural tension. I will be performing the test item cluster for patients with hip osteoarthritis. So age greater than 50, hip flexion less than or equal to 115, and hip internal rotation less than 15 degrees. I will be performing the valgus test at the knee. I'll be performing the Lockman's test. Try not to do that multiple times if it's positive. I will be explaining the differential diagnosis between glute ham weakness versus an L5 or S1 radiculopathy. So for glute ham weakness, you're going to see just that, either weak glutes or hams, but that's it. If it's an L5 or S1 radiculopathy, you're going to have, for L5, great toe extension is going to be weak. For S1, plantar flexion would also be weak, along with the glutes and the hams. And then you're also going to have, for L5, sensation issues on the outer portion of the lower leg. For S1, maybe on the back of the leg near the Achilles. And that would be how you diagnose it.